Around the world, 5 diseases continue to take countless canine lives every year. The first is canine distemper. With a fatality rate as high as 80 to 90%, it begins with fever and coughing and progresses to seizures and paralysis. Without vaccination, survival is almost impossible. Let's get started. Canine distemper is an infectious viral disease that affects dogs and other carnivorous mammals. It is caused by a virus called canine distemper virus, which belongs to the family Paramyxoviridae. This virus attacks the respiratory tract, gastrointestinal tract, and nervous system of dogs. Once infected, the virus enters the body through the nose or throat and then spreads to the lymph nodes, where it replicates. From there, it spreads to other parts of the body, including the lungs, gastrointestinal tract, and the brain. Clinical signs of canine distemper include high fever, respiratory distress, gastrointestinal upset, neurological signs such as seizures, paralysis, and finally death. The incubation period for canine distemper is typically 1 to 2 weeks. The virus has a high mortality rate, ranging from 80 to 90% in unvaccinated dogs. However, with supportive care, some affected dogs may survive. The virus is highly contagious and spreads through direct contact with infected dogs or their secretions. It can also be transmitted indirectly through contaminated surfaces or objects. Vaccines are available to prevent canine distemper, and all dogs should be vaccinated according to the recommended schedule by the American Animal Hospital Association. There are 2 types of vaccines available: modified live virus vaccines and inactivated virus vaccines. The modified live virus vaccines contain a weakened form of the virus, while the inactivated virus vaccines contain a killed virus. Booster doses are necessary to maintain immunity against the disease. In addition to vaccination, other preventive measures include avoiding contact with infected dogs, disinfecting contaminated areas, and providing good nutrition and general health care. The second is parvovirus. Once a dog starts vomiting and passing bloody stool, the disease may already be critical. The fatality rate can reach 50 to 90%, leading to rapid dehydration, shock, and death within hours. Parvovirus infection, commonly known as parvo, is a highly contagious viral infection that affects dogs. It is caused by a virus called canine parvovirus type 2, which belongs to the family Parvoviridae. The virus attacks rapidly dividing cells in the body, particularly those in the gastrointestinal tract and bone marrow. Once infected, the virus enters the body through the mouth and then replicates in the lymph nodes. From there, it spreads to other parts of the body, including the gastrointestinal tract and bone marrow. Clinical signs of parvovirus infection include vomiting, diarrhea, fever, and loss of appetite. The incubation period for parvovirus infection is typically 3 to 7 days. The fatality rate for parvovirus infection varies depending on several factors, including the age and overall health of the dog. However, it can range from 50 to 90% in unvaccinated dogs. While there is no specific cure for parvovirus infection, supportive care can help affected dogs recover. This includes intravenous fluids to prevent dehydration, antibiotics to prevent secondary infections, and medications to control vomiting and diarrhea. Like canine distemper, parvovirus is highly contagious and spreads through direct contact with infected dogs or their feces. It can also be transmitted indirectly through contaminated surfaces or objects. Vaccines are available to prevent parvovirus infection, and all dogs should be vaccinated according to the recommended schedule by the American Animal Hospital Association. It is important to note that puppies are at higher risk of developing severe complications from parvovirus infection, and vaccination should be started early in life. In addition to vaccination, other preventive measures include avoiding contact with infected dogs, disinfecting contaminated areas, and providing good nutrition and general health care. Third is rabies. The very name is terrifying. and once clinical signs appear, the fatality rate is 100%. A single vaccine can completely prevent it. Rabies is a viral disease that affects the central nervous system of mammals, including dogs. It is caused by the rabies virus, which belongs to the family Rhabdoviridae. The virus is transmitted through the saliva of an infected animal, usually through a bite. Once the virus enters the body, it travels to the central nervous system, where it replicates and causes inflammation of the brain and spinal cord. Clinical signs of rabies include behavioral changes, such as aggression or paralysis, difficulty swallowing, anxiety, agitation, hypersalivation, paralysis, and finally death. The incubation period for rabies varies depending on several factors, including the location of the bite and the amount of virus introduced into the body. However, once symptoms appear, the fatality rate is 100%. There is no specific cure for rabies, but a vaccine is available to prevent the disease. All dogs should be vaccinated against rabies according to the laws and regulations of their country or region. It is important to note that rabies is a zoonotic disease, meaning it can be transmitted from animals to humans. If you suspect your dog has rabies, contact your local animal control or public health officials immediately. The fourth is heartworm disease. Spread by mosquitoes, these parasites settle in the heart and pulmonary arteries, draining life slowly over years. Often unnoticed at first, it ends in breathing difficulty, circulatory collapse, and death if untreated. Heartworm disease is a potentially fatal condition caused by parasitic worms called Dirifilaria imites. These worms live in the heart and blood vessels of dogs and other animals, including cats, coyotes, and wolves. Heartworm disease is spread through the bite of an infected mosquito. When a mosquito carrying heartworms bites a dog, the worms are released into the bloodstream. The worms then travel to the heart and lungs where they grow and reproduce. Clinical signs of heartworm disease include persistent cough, difficulty breathing, weight loss, and lethargy. As the worms grow and multiply, they can cause inflammation and damage to the heart and blood vessels. This can lead to heart failure, pulmonary hypertension, and other serious complications. The incubation period for heartworm disease varies depending on several factors, including the number of worms transmitted during a mosquito bite. However, it typically ranges from 6 months to 2 years. Heartworm disease can be prevented through the use of preventive medications, which are available in various forms, including pills, liquids, and topical applications. In addition to medication, dogs should be kept indoors whenever possible to avoid mosquito bites. Once heartworm disease has been diagnosed, treatment options include a combination of medication and rest. Surgery to remove the adult worms is also an option, but it is typically only performed in severe cases. And the fifth is canine coronavirus enteritis. Alone, it may cause diarrhea and vomiting, but when combined with parvovirus, it becomes deadly, with a fatality rate soaring above 50%. Canine coronavirus enteritis is an infectious disease that affects the gastrointestinal tract of dogs. It is caused by a virus called canine coronavirus, which belongs to the family Coronaviridae. The virus attacks the cells lining the gastrointestinal tract, causing inflammation and damage. Once infected, the virus enters the body through the mouth and then replicates in the gastrointestinal tract. Clinical signs of canine coronavirus enteritis include diarrhea, vomiting, fever, and abdominal pain. The incubation period for canine coronavirus enteritis is typically 3 to 5 days. The severity of the disease varies depending on several factors, including the age and overall health of the dog. However, it is generally mild to moderate. The fatality rate for canine coronavirus enteritis is low when the disease occurs alone. However, it can increase significantly when the virus co-infects a dog with parvovirus. The combination of these two viruses can cause severe dehydration and shock, leading to death within hours. There is no specific cure for canine coronavirus enteritis, but supportive care can help affected dogs recover. This includes intravenous fluids to prevent dehydration, antibiotics to prevent secondary infections, and medications to control vomiting and diarrhea. Like other viruses discussed previously, canine coronavirus is highly contagious and spreads through direct contact with infected dogs or their feces. It can also be transmitted indirectly through contaminated surfaces or objects. Vaccines are available to prevent some strains of canine coronavirus, but their effectiveness is limited. Other preventive measures include avoiding contact with infected dogs, disinfecting contaminated areas, and providing good nutrition and general health care. Here is the crucial message. All of these diseases can be prevented. Vaccinations and regular checkups are the shield that can save your beloved companion. If you want your dog to live longer and healthier, you must act now. Confirm the vaccination schedule with your veterinarian and never miss a booster shot. Your furry friend depends on you to keep them safe, so don't delay. Take action today and give your dog the gift of a long and happy life. Remember, prevention is the most powerful weapon to protect your dog's life. If you found this video helpful, please like and share it so that more people can learn about the deadly diseases that affect dogs. And don't forget to subscribe for more informative content about dogs. Thanks for watching.